Hello and welcome to the second talk of the ISN Education Ambassadors, courtesy of the invitation of Professor Ahmed Aql, a dear friend and colleague, who asked me to prepare these two talks exclusively for you young nephrologists, part of the ElNahas cycle of ISN educators. The first talk, as you recall, was on some aspects of good clinical practice based on the relationship between the doctor and the patient. And we identified 5 key elements. One is to put yourself in the patient's place and to be the patient's agent, the one who cares about him, the one who wants to be on his side. Show respect to the patient, how you listen to him, how you give him time, how you talk to him. Establish a partnership, a link, a team between the caring team, you as a doctor, and the patient. You have to work together to get the best result. Most important, take all this into consideration and personalize your care. And as I said then, he's not a condition, a nephrotic syndrome. He's a patient. He's not a glomerulonephritis. He's not 2 kidneys with glomerulonephritis. He's a whole human being who is ill, who's anxious, who needs you, and you need him to get the best out of your treatment. And finally, be honest, be truthful, be frank, because patient can read through you, can see if you're lying, if you're not telling the truth, if you're trying to please him. All this diminish and separate the relationship and the partnership and weakens it. Now, the extra element to improve and optimize your good clinical practice is continuing learning, continuing updating yourself on different advances and progress, but most important, to have a critical, reflective practice. What does it mean? It means that everything you do, you ask yourself a question before you do it, so that you do it well, you do it to your best of your ability, the best possible knowledge that you have for the best outcome for the patient. And here I'll propose to you a framework of 5 questions. The 5 whats. The first one, what am I doing this for? The second one, what is the evidence that what I'm doing is correct? The third one, what is it useful? What is the utility for that particular person, part of his personalized medical care? The fourth one, what is the risk versus benefit? And the fifth one, what is the cost versus benefit? Let's start. What am I doing it for? Whether it's an investigation, a radiological test, a blood test, a PCR, a renal biopsy, ask yourself, what am I doing it for? You are the patient agent. So the next question is, am I doing it for the best interest of the patient? Or am I doing to satisfy some intellectual curiosity? I need to know what subgroup of FSGS this histology is, or I need to know whether this diabetic patient of 80 years old has diabetic nephropathy, and it won't change your management. So unless it changes your management, don't do the investigation, don't engage on a treatment that may have side effects and that may be harmful rather than beneficial. So always ask yourself, in the place of the patient, why am I doing this? What am I doing this for? Second question. I decided to do this test, this investigation, this X-ray, this blood test, this biopsy, or embark on a given treatment. What is the evidence that this treatment works? You need to know, because the patient could ask you, what are the percentage chances that this treatment will induce a remission, doctor? I don't know. It's good, but I don't know. That's not good enough. You need to tell him, with this treatment, part of our partnership, working together scheme, there is 62% chance that you will get complete remission. 82% chances that you'll get a partial remission, and so on and so forth. You need to know so that he has confidence in you. If he senses that you don't know and you tell him take a toxic drug, cyclophosphamide, 3 milligram per kilogram, he may develop pancytopenia, etc. And you're not quite sure whether it's good or bad, but you've heard an abstract in a conference, in a workshop at the Kernes or elsewhere, and you decide, well, I'll give him this and see. That's not good enough. You need to know the evidence, the clinical trials, the data, the statistics, so that your prescription is validated. Third question, what is the utility? The utility means part of the personalized treatment, that this particular treatment suits this particular patient. A treatment for a nephrotic syndrome in a 6-year-old is not the same as a treatment for a nephrotic syndrome in a 50-year-old or a 90-year-old. You have to adjust the treatment. You have to personalize the treatment. There aren't two patients alike. This patient that you treat in front of you is always unique. Treating an ANCA-positive vasculitis in a 25-year-old who you can give him full immunosuppression, it's not the same as in a 70-year-old. Look at the evidence and look at the trials. Are the trials done for that particular group of patients? Elderly, young, Asians, Africans, Middle Eastern, North American. What's applicable to somebody in Japan may not be applicable to you in Egypt. So always remember the utility of the intervention for that particular patient. 4, look at the risks and the side effects of what you're going to do. A biopsy, a kidney biopsy, can lead to severe hemorrhage, can lead to a nephrectomy, can lead to death. And there are people and patients who died from an unnecessary renal biopsy, or died from unnecessary immunosuppression, and so on and so forth. So you have to be sure that the risks is lower than the benefit. If you have a good benefit, low risk intervention, go ahead and do it. If you have a high risk, low benefit intervention, don't do it. If the two are balanced, then again it's a team decision. You talk to the patient, you come together and you discuss it. Not that I will give you this, you will have to take it, this and that. That's not good clinical practice. And finally, the fifth, the final one, is the cost benefit. Very often there are two similar drugs that you can easily choose the cheaper one to save the patient money, to save your hospital money, to save your community money, and achieve the same result. So think cost and think benefit. A good treatment will be high benefit, low cost. If it's high cost and low benefit, don't do it. If the two are the same and the patient has to pay, he hasn't the medical insurance, then in that condition, discuss it with him. Part of the listening to what he says and what he doesn't really tell you, I can't afford it, doctor, in order to reassure him and come up with the best possible package. So reflective practice, critical thinking practice is based on 5 questions. What am I doing this for? What is the evidence that what I'm doing is correct? What is the utility for that particular person, part of his personalized care plan, that this is right for him? Risk-benefit analysis and cost-benefit analysis. And get to the habit of this approach automatically, and you'll find that it will become a second nature. It will improve the delivery of care. Your care and your management will be safer. And again, as the patient's agent, you would have done the best for him and for you as you continually improve your knowledge, continually learn to deliver a better care. Good luck. And I hope you enjoy the 2 talks and you enjoy this wonderful ISN workshop. Thank you very much.